There are 13 types of insomnia. Here's what to know about each one. You don't have to lie awake for hours past your bedtime to have insomnia. This sleep-robbing condition can manifest in several different ways. Having trouble falling asleep, staying asleep, and even waking up too early are all signs of a sleep disorder. To help you determine what kind you may have, Health.com has compiled a list of 13 classifications of insomnia, with help from the American Academy of Sleep Medicine. General insomnia. General insomnia is a classification of sleep disorders in which a person has trouble falling asleep, staying asleep, or waking up too early. Insomnia affects up to 40% of the general population each year, per the American Psychological Association. Other factors that can contribute to insomnia are divorce, separation, and losing a loved one, as well as lower socioeconomic status. Adjustment insomnia. This primary insomnia, also called acute insomnia, is a type of short-term insomnia, meaning it lasts fewer than 3 months, according to the Sleep Foundation. Adjustment insomnia disturbs your sleep and usually stems from a specific source of stress. This sleep problem resolves itself when the source of stress is gone or when you've adapted to the stress. This stress does not have to come from a negative experience. That being said, adjustment insomnia can turn into chronic insomnia, so if you find yourself losing sleep for longer than 3 months, you should seek out a sleep specialist. Behavioral insomnia. Of childhood. As children grow, their sleep behavior changes drastically. Naps are discontinued, nocturnal sleep is extended, and the standard bedtime is pushed further and further back. These changes are known as behavioral insomnia of childhood (BIC), and can cause sleep disruption in approximately 25% of children, according to the National Institutes of Health (NIH). Psychophysiological insomnia. This primary type of insomnia is prevalent in older children and adolescents, as well as adults. According to the NIH, this insomnia is associated with excessive anxiety or worry, specifically focused on not being able to sleep. Unfortunately, it's cyclical, meaning the very act of worrying about sleep makes sleep very difficult to achieve. People with this sleep disorder become tense and anxious as bedtime approaches, and develop a negative association with sleep, making this type of insomnia tricky to navigate. Idiopathic insomnia. Idiopathic insomnia is a primary form of chronic insomnia that is not identified by visible signs of its cause, according to the American Sleep Association (ASA). It may result from an imbalance in your body, such as an overactive awakening system and/or an underactive sleep system, but the true cause of this disorder is unknown. Paradoxical insomnia. Paradoxical insomnia is a complaint of severe insomnia. This primary insomnia occurs without objective evidence of any sleep disturbance. Daytime effects vary in severity, but they tend to be far less severe than one would expect given the expressed sleep complaints. Inadequate sleep hygiene. Insomnia. Inadequate sleep hygiene is a disorder associated with common daily activities that are inconsistent with good quality sleep and full daytime alertness, according to the NIH. These activities could include irregular sleep patterns, going to bed at 3 a.m. and sleeping until noon, stimulating activities before bedtime, exercising late at night, and substances ingested before bed such as caffeine, alcohol, or cigarette smoke. Insomnia due to a medical condition. This secondary insomnia is caused by a medical or neurological disorder, where the insomnia is a symptom of the disorder, according to the NIH. The course and severity of insomnia are directly linked to that of the medical condition, but the insomnia is a separate focus of treatment. This insomnia is a disorder only if it is severe enough to require separate treatment. Insomnia due to a drug or substance. This type of secondary insomnia occurs when your sleep is disrupted by the use of a substance such as alcohol, caffeine, food, or medication. With alcohol, caffeine and food, sleep problems occur because these substances, when used in high concentrations, stay in your body for several hours after consumption. Unfortunately, this type of sleep problem may also occur when you stop using a substance, so weaning yourself off of a substance you normally ingest before bed is better than stopping cold turkey. Unspecified insomnia. Unspecified insomnia is when a cause has yet to be specifically proven, so further testing is required to discover the exact cause. Unspecified is used as a temporary classification while further evaluation and testing are completed. There are two subtypes of unspecified insomnia. Insomnia non-organic, unspecified. This type of insomnia suggests that known substances and other physical causes of the insomnia have been ruled out. This means that the cause of insomnia is most likely due to an underlying mental health disorder, psychological factor, or sleep disruptive behaviors. Insomnia organic, unspecified. This type of insomnia is caused by a medical disorder, physical condition, or substance exposure, but the specific cause remains unclear. This name is used when a person with insomnia does not meet the criteria for another type of insomnia.